For us as parents, seeing our little ones cry is a normal thing. But, have you ever felt something different about their crying? Becoming a new parent is indeed exciting, especially since babies can't talk yet to tell us where their body hurts. They can only communicate through crying, fussing, or changes in behavior. Sometimes, symptoms we consider trivial, such as lethargy, reluctance to breastfeed, or cold hands and feet, turn out to be emergency signals of a life-threatening illness. In this video, we'll discuss in depth how to recognize the symptoms of dangerous illnesses in babies, their risk factors, and 8 types of critical illnesses to be aware of so we can act quickly and appropriately before it's too late. Let's discuss them one by one. Before we get into the types of illnesses, parents should first understand how a baby's body signals when they are attacked by a serious illness. When a baby is seriously ill, their cries usually sound different, much louder, shriller, or even continuous without stopping. On the other hand, there are also babies who manifest as being very weak, always sleepy, and their bodies feel limp like a rag doll when picked up. Additionally, pay attention to these physical signs: pale, bluish, or yellow skin on the face or body, an unusual reddish rash, green or bloody vomit, refusal to breastfeed, or a drastic decrease in urination frequency or no urination at all for several hours. Body temperature is also a fatal indicator. It's not just a high fever, mom. If a baby's body temperature suddenly drops drastically below 36 degrees Celsius, especially in babies under 3 months old, plus cold feet and hands, this is a major danger sign that requires immediate medical attention. Why are babies, especially newborns, so vulnerable? Their immune systems are not yet fully developed. However, there are several risk factors during pregnancy and childbirth that make a baby much more susceptible to dangerous infections. These include premature or preterm births. Furthermore, a history of maternal infection during pregnancy, or a fever leading up to delivery, is also a risk factor. Premature rupture of membranes more than 18 hours before birth is also a primary route for bacteria to invade the baby. Also, a history of using certain medications or alcohol during pregnancy. If your baby has any of these conditions, parents should be extra vigilant in monitoring their daily development. The first illness is diarrhea. Distinguishing diarrhea in breastfed babies is a bit challenging because their stools tend to be soft. However, if the stool is really runny, comes out very frequently, the mouth is dry, the eyes are sunken, and the baby cries without tears, be alert. This is a sign of severe dehydration due to diarrhea, which can be life-threatening if not treated immediately by a doctor. Second, RSV, or respiratory syncytial virus. This is a viral infection of the lungs that often triggers bronchitis and pneumonia, especially in premature babies. Symptoms include rapid, noisy breathing, coughing, runny nose, and the child appears lethargic. If a child is affected by this, the first steps are to isolate them from other sick people, keep the air in the house clean, and completely avoid cigarette smoke. Seek medical attention immediately if the child is short of breath or their skin starts to turn blue. If a child is affected by this, the first steps are to isolate them from other sick people, keep the air in the house clean, and completely avoid cigarette smoke. Seek medical attention immediately if the child is short of breath or their skin starts to turn blue. Don't take it lightly, because if it is treated too late, this infection can cause permanent hearing loss or even meningitis. Fourth, diabetes in babies. This disease threatens babies born to mothers with a history of gestational diabetes during pregnancy. Babies are usually born with a much higher birth weight than normal, experience jaundice, shortness of breath, tremors, and even seizures. This condition must be closely monitored by a pediatrician because it carries a high risk of developing type 1 diabetes later in life. Fifth, retinoblastoma. This is a malignant tumor or cancer of the retina that attacks children under 2 years of age. The characteristic sign is the presence of a white reflection of light resembling a cat's eye in the child's pupil. When exposed to light, the pupils dilate, or the eyes appear crossed. This cancer is very aggressive and can be fatal if diagnosed too late. Sixth, meningitis, or inflammation of the meninges due to a viral or bacterial infection. Symptoms in infants include high fever, stiff neck, vomiting, extreme sensitivity to light, a rash, and even seizures. This is a medical emergency that requires immediate hospital antibiotic or antiviral treatment. Seventh, sepsis. This is a condition in which a severe infection has spread throughout the baby's bloodstream. It usually affects premature babies or babies who contract an infection during delivery. Symptoms include babies who stay asleep, breathing very fast, having an unstable body temperature either too high or too low, and skin that appears pale or yellow. Sepsis is a silent killer in babies that must be treated within hours. 8. NEC, necrotizing enterocolitis. This disease occurs when a baby's large intestine becomes inflamed, causing sores or holes. It often occurs in premature babies, low birth weight babies, or babies fed formula, whose intestines are not yet ready. The symptoms are a swollen and painful stomach when touched, green vomit, weakness, and blood spots in the stool. Moms and dads, reading about this list of illnesses might make us feel scared and worried. However, our goal in knowing this isn't to panic, but rather to make us smarter, more alert, and more careful parents. A baby's immune system is still weak, and experiencing minor illnesses is part of their immune development process. The key is, if you notice even one of the severe symptoms we discussed earlier, or if your little one shows extreme behavioral changes that don't improve, don't delay. Don't try to treat your child yourself with over-the-counter remedies or potions. Take your child to a pediatrician or the nearest emergency room immediately for a proper medical examination. Our quick action can save their life. This is a natural way to introduce different flavors to babies, so that when they are 6 months old, they will be more easily able to adapt to solid foods and will not become picky eaters. Thank you for watching this health guide. Don't forget to like, subscribe, and share this video with your family group or fellow parents to help protect more babies. Let us know in the comments if you have any experiences you'd like to share. Stay healthy, stay alert, for the sake of your beloved children. See you in the next educational video.